So let's talk about ADHD. Um, First of all, it's real. A lot of people think of ADHD as bad parenting, not enough discipline, not having structure, and those things for sure affect any child, and they also equally affect kids with ADHD. But the difference between a child that has just poor structure, poor parenting, no discipline, etc., is that those things affect them to a certain degree, but they don't affect their school routine. For example, most teachers, most schools will have a particular set of rules and routines that if a kid does not have ADHD, then they'll behave very well in the school. And then when they get home, then the parent has a lot of complaints about their behavior, and so on and so forth. So one of the most important criteria for ADHD to be diagnosed is that it occurs in more than one environment. The reason we do that, the reason we request that both the parent and the teacher fill out a questionnaire in regards to ADHD is precisely to kind of weed out those kids that may just be lacking enough discipline, structure, and routine in their homes from those that really have a problem with their attention span and their ability to control their impulses, which is ultimately what's going on in ADHD. The underlying problem in ADHD is called executive functioning. That's a difficult concept to understand, but it basically means that the part of the brain that is in charge for controlling the actual executive, the actual going ahead and doing something, and the part of the brain that has all the information, that understands what's right, what's wrong, what will get them in trouble, and what will get them a reward, is they're not communicating very well. There's a deficiency in that communication. That's a simple way to put it. And when that happens, what the child will do is usually they'll do something, and 5-10 seconds later, in their brain, they go like, "Oh, dang, I shouldn't have done that. My dad told me 20 times already that I shouldn't do that. My mom has spanked me in the past or punished me in the past." They know it later, but they don't know it when they actually do it. So the classic concern or the classic complaint that a parent will have with that is that, for example, and my light just went out, but I'll just keep talking. For example, is that Johnny, go get me your shoes, and then I need you to grab your bag and let's go to school. And Johnny goes, and he forgot by the time he gets to his room. He totally forgot what he was instructed to do, or maybe he remembered to get his bag, but he forgot the first thing, which was to get his shoes. And the parent gets upset. It's frustrating because this is the 200th time that you have told him, and this is what he does every single day, and yet he forgot again. It's really not to excuse the child, but there is a real problem within the way their brain functions, to where they easily lose focus and they get distracted. They heard something and all of a sudden their attention shifted, and so on and so forth. And so again, ADHD is real, but it has to be in more than one environment. If you have a kid that is only ADHD at home, that's a kid that probably needs a little bit more counseling as far as parenting style, to try to adapt to that kid's personality. But if a kid is the same way in school, the same way with the teacher, the same way with a family member than with mom, etc., or similar patterns, then that kid has ADHD. Now, once you establish the diagnosis, and we usually do it with a questionnaire called Vanderbilt. There's some other ones that we can use as well, but Vanderbilt works pretty good. Once you establish the diagnosis and you kind of rule out other things that might be going on, then the next step is to figure out, okay, what does this kid need in order to succeed in life? What does he need in order to stop getting in trouble, start getting better grades, but just as importantly, better relationships? That's something I haven't mentioned. Usually everybody's aware that ADHD can lead you to school failure or school trouble, but they don't realize that it can also lead you to social trouble. Kids are very friendly, they're very smart usually, and they love people, and they can be really witty and make a new friend. But just as they made the new friend, they lose the new friend because they're impulsive. They don't listen to what the friend wants to do. They're always trying to do what they want because they're so impulsive. They don't have that regulation that tells them, hey, we already did one time what you wanted. Why don't you let your friend lead the show for the next few minutes? They don't understand that, so they lose friendships. And they also have that same type of social problem in the home with their siblings, with the parents. So what can we do to help the kid? Many times parents want to do natural supplements, vitamins. They've kind of done all sorts of research, and the last thing they want to do is stimulant medication. And that's understood. None of us, not I, not any parent, wants to put their kids straight into a medication for anything, antibiotics or anything at all, if you don't have to. So it is reasonable for just when you come to realize your kid might have ADHD, it'll be great if you can just go online and read about ADHD, how to structure their life, how to build a routine around them, how to address their impulsivity and their forgetfulness, and how to have a lot of understanding, how to change your expectations of your kid. We as parents, we all have an expectation, and we need them to be behaved and sit down and stay sitting down and don't move. For a normal child, that may be very easy to do. But for a kid that's ADHD, you told them to sit down and stay still, and they hold their pose for 10 seconds, maybe a minute if you're lucky, and then they forget and they start jittering. So understanding that they're not really being disobedient for the sake of being disobedient, but rather they're really having a hard time remembering to do what's right, remembering to do what you told them or what it's expected of them. If as a parent you change that view, if as a parent you just comprehend that your child actually is different and has that inability, that difficulty, then even if you have several children and some of them don't have ADHD, then you'll have a much better time addressing that one child and being patient with that one child. So that's part of the thing for us as parents, to have a different expectation of our child. Doesn't mean to excuse them. I never mean they shouldn't be kind of held to the same education. No, but you go about it a different way. Let me give you an example. If your child is super forgetful, and let's talk about a teenager, because I'm right now mentally thinking about the younger child, but let's say a 14-year-old, and you give him a few things to do, that you need him to wash dishes and take out the trash, and next thing you know, the afternoon comes and they're watching TV, and you ask him and they look with a dumbfounded face like, I'll do it right now, and then you get upset. Well, they literally forgot. They literally forgot what you told them to do. So maybe what you need to do is have a board, and you tell them, hey, Johnny, I'm going to write down what I need you to do today. Make sure that you do it. And as a matter of fact, I'm going to put a sticky note in the middle of the TV so that before you even watch TV, you make sure that you go and do it. So we put reminders, things that rely less on memory and more on just mechanics. Like, okay, when he's going to sit down to watch TV, he sees the sticky note and he goes and he remembers that he needs to go see the board. Things like that, for example, and it's okay. You can't expect them to remember. So there's a lot of little things. I mean, it would be endless to keep talking about little details and stuff to do. Now, once you kind of gone through the different reading materials about what to do with your child, and you already tried whatever kind of seemed reasonable for you to try nature-wise, which they don't work, but you are satisfied to your level that, you know what, I already tried to give him vitamins, I already tried to take away caffeine or do this. All those things, by the way, don't have anything to do with how the brain works. Yes, sometimes some things can make things worse for a kid with ADHD. Sugar is not one of them, for example. Kids just get high when they're in a birthday setting and they just look very ADHD, but it's not the sugar, it's just the environment. Caffeine can actually, because it's a stimulant, it can actually calm them down. So again, there's a lot of things that can have different effects. But the underlying problem, the way that their brain functions with ADHD, requires medication to be fixed. Now, not everybody with ADHD needs to be fixed, needs medication, but some kids do. And those are the ones that you definitely want to talk to your doctor. You definitely want to go through all the reading material, all the diagnostic tests, which your pediatrician should be able to do, and many primary care doctors as well. You don't really need a psychiatrist for ADHD unless your doctor thinks there's something else. That's when we kind of refer to a psychiatrist. But for straightforward ADHD that presents in a very classic way, all you need to do is kind of get to the point in your decision as a parent that you're going to medicate him. Now, medication is fantastic. When it works really nice, and kids' self-esteem gets better. Their desire to go to school, their desire to study, to learn. I mean, it's just magical. And that's one of the reasons I really enjoy treating ADHD, because I see it over and over how kids that had a real medical problem, a mental health problem, real is the key. Then you put them on medicine, just like you would treat diabetes and there's, with insulin and their sugar goes down, you treat ADHD with medication, and their impulsivity and their lack of emotional stability, their lack of self-control, all of a sudden gets a lot better. And you have a child that's no longer fighting all the time with everybody, including their parents, that seems more sure of themselves, happier with school, getting better grades, being very proud of who they are. That being said, the specific medicine, there's a couple of categories. There's the stimulants, and then there's the non-stimulants. A lot of people want to get started on non-stimulants, and that's kind of okay, but we do have to realize that that's not the preferred starting point. The preferred starting point is the stimulants, which basically consist of Ritalin, which is methylphenidate, or in a different category, the amphetamines, which is like Vyvanse, Adderall, and some of those. Now, when you talk about Ritalin, stimulants, Adderall, amphetamines, it almost sounds like you're saying bad words. A lot of people associate that with drug addiction. And the way I explain it is just like anything. Anything is toxic if you take too much of it. Amphetamines are definitely a street drug. If you take 10 times the dose that I'm going to prescribe to your child, or maybe even more, they do become addicted if you take high doses, because they're stimulating your brain and they start craving it. But I have never seen it, and the studies don't show that if you keep the medicine at medically prescribed dosages that you're going to have any problems with addiction. On the contrary, sometimes as kids and people with ADHD grow up older and they have not been treated, and they have this drive and this impulsivity and stuff like that, the same impulsivity leads them to try different drugs. And when they come across amphetamines or stimulants, they like them because they actually feel more in control of themselves. And then because there's no doctor following them or teaching them how to use it, they start abusing it. So what I mean to say by that is, if you're concerned about your child as young or whatever age they might be, that they will become addicted, don't be concerned. Yes, there is a potential for addiction. Yes, we do watch out in some particular populations what we prescribe, because if they have already a history of drug use, they could start taking a lot of the medicine. Instead of the prescribed dose, they could overtake it, and we are careful about that. But if you take the medicine at the prescribed dosages in the prescribed manner that we tell you, there's no real risk of getting addicted to that dose. If you get to be on a high dose, then you might want to step it down for like a week's time from a very high dose, kind of go down until you get off it, but you won't be addicted. It's not like a caffeine, not caffeine, it's not like a tobacco addiction or something like that. So they are very safe. I'm saying that because that's one of the most concerning things that parents tell me. So again, Ritalins, amphetamines, and then non-stimulants. Ritalin will work for 70% of people and not work for 30%. And amphetamines will work for 70% of people and not work for 30%. And so when deciding on what to start, there's a few factors that we can consider, but ultimately it's just parental and physician preference as to what to start a kid on, or a teenager for that matter. Duration of the effect, all those things kind of play a role, and that's like a medical decision that's done on the spot. Now, when stimulants fail, or in some particular populations, like we don't usually treat kids less than 6 years of age, but if we are going to treat a kid less than 6 years of age, we might use more of a non-stimulant because the effect is more prolonged. It doesn't tend to be as an intense of an effect, but it does last a little bit longer. So that's a nice kind of little thing to have in a child, that you're not only trying to calm down and get focused and get him to learn during a particular time of the day, but you rather want to have him like a little bit more leveled off. So that might be a particular group. And then in adult medicine also, we might use non-stimulants because you're not trying to get focused just during your work hours. Most adults want to feel that sense of control throughout the day. So there's medicines like Strattera, which is the one that I mentioned for kids, tamoxifen, Strattera, and there's also Wellbutrin. And then there's some other antidepressant medications that may or may not have a little bit of effect, but those are the two preferred ones. Having said that, stimulants are still the preferred route for adults. So again, this is all a lot of medical decision making, and you should try to find a physician that is comfortable, knowledgeable, and can follow you closely for ADHD, whether it's for your children or for yourself. Let me see, what else can we talk about? Side effects of the medications, usually headache, abdominal pain, definitely loss of appetite, but all those three tend to kind of wean through time. If the appetite suppression was that good, then most people would take it for diet to lose weight, but it doesn't work that way. It usually kind of weans off a little bit. And it's definitely only while you're under the effects of the medication, which is usually 8 to 12 hours. There's mention in the literature about that it can delay growth. That's not a real concern. I mean, I'm not going to discard it completely. I can say I've never seen it, and I've treated a lot of kids, and they seem to always be growing well. If you have a child that's not growing well and they happen to be on ADHD medicine, maybe you want to consider doing some of the non-stimulants or something else. But I've never had to do shift of medications because of that. Now, of course, when it comes to mental health and psychiatry, things are not straightforward. That's another point to mention. A lot of things can look like ADHD. If a child's not sleeping well, if they're having a poor social environment, they can be acting out and acting aggressive and stuff like that. Something that's usually associated also with ADHD is oppositional defiant disorder. That's a whole different subject. Again, it takes a trained professional that is comfortable with mental health and ADHD to diagnose properly and treat. As a matter of fact, the form that I talked about, the Vanderbilt, the first 18 questions address the ADHD, and there's some other questions that kind of go quickly over anxiety, depression, and other differential diagnoses that can get confused with ADHD. So I think I've covered a lot of what I usually talk about. Of course, there's a lot of advice that I give parents on a one-to-one basis that I don't think is worth talking about here. I actually ran way past what I was hoping to to do. But I hope I gave you a good rundown of ADHD. Bottom line, it's real. It has to be presented in at least 2 environments. If it's only at home or only in school, then that's a discipline structure issue. It's not ADHD. So it has to be present in 2 environments. It can be addressed initially with modification of structure and some of those things, structure, schedule, reminders, etc., like some like life coaching type techniques. But ultimately, the only treatment for ADHD that truly works in a very wholesome way is medications. And so talk to your doctor and get your kid the help. You really will not be sorry. Now, the last point I'll make is when you're deciding about doing medication on your child, you're really not what I called marrying the medication. It's just you're willing to try it. You're willing to give it a good 3, 4, 6 months to work. And the reason I say that is because we usually start at a low dose and kind of build up little by little, where we're either getting the maximum benefit for the medicine without side effects. But sometimes we're getting benefit. We're not at a really acceptable benefit, boom, we hit a side effect that we have to take the medicine away. And so if we do that, then we have to start over with another medicine. And that's just the way it goes. It's a lot of trial and error, unfortunately, but that's kind of what it is. Again, it takes a trained professional that's comfortable with this disease to treat you. And last, just came to mind, a lot of people tell me, like, I don't want my kid to be a zombie. Well, guess what? That zombie-like state, that's a side effect that makes you immediately want to take them off that particular medicine. So, for example, if they're in Ritalin and they get just sleepy and kind of like blind stare, that's not okay. That's not what the medicine's meant to do. The medicine's meant to just help them focus and be less impulsive, but it's not meant to change who they are. They're still your kid. They're still the same person, but more controlled. So I hope this talk helped. I mean, it's one of my passions, ADHD, for many reasons that I won't go into right now. But I hope it helped you kind of give you some perspective on what it is and how you can treat it and what the steps are to get there. Talk to your doctor and good luck. Just be open to the possibility. Mental health is very stigmatized, and a lot of people think that because their kid needs treatment for ADHD, they somehow are failing as parents, and that's not at all the case. I've had really good parents really trying hard, their best. They're educators, they have other kids that are doing great, and they have one child with ADHD that unless they help them through medicines, they just, the kid's life and social environment is just very stressful, and it stresses the family and it stresses everybody. So I am really looking forward to your questions. I appreciate all those people that have posted questions on the other videos. I hope I didn't make this video too long. I'm sorry if I did. Let me know if you want shorter versions. I just try to be as complete as possible. So I'll be looking forward to hearing from you guys. Okay? Take care. Have a good day.